I will discuss today the importance of Asbab Sitta Daruriyya, which is a Unani concept which may be simplified as diet and lifestyle during pandemic, especially. So this is a Unani concept which is important for maintenance of health and prevention from diseases. The highlights of today's presentation will be Asbab Sitta Daruriyya, what is his and its role in prevention of disease and how to modify these six essential factors according to Unani principles to prevent from pandemic infections. So these are six essential factors for maintenance of healthy life. The first one is Hawa, which may be called as air, ambient air, and the air in which we are respirating. The second thing is Makulu Mashroob, water and edibles, which we are consuming. The third thing is Harkato Sukune Badani, physical activities and physical rest. The fourth one is Harkato Sukune Nafsani, mental activities and mental rest, or maybe called as good emotions. The fifth thing is moderate sleep, Namayaksa, the sleeping and awakening pattern. The last and sixth factor is istifrag or iktibas, which may be called as removal of morbid materials from the body and retention of essential fluids in the body. So, according to Unani principles, which are linked to these six factors, I want to emphasize on two principles. One is Hifz Sehat, that is prevention of disease, how to modify these factors to keep one prevented from infectious disease. And the second is taqwiyat, which may be uh, considered as to modulate and potentiate the immunity of the body. So there are certain methods to be adopted. First one I want to emphasize here is muqawiyat. Muqawiyat are certain substances or certain therapies and measures which are taken to potentiate the immunity. And the second one is the riyaqat. These are measures to prevent the body from harmful effects of the toxins or infections or any kind of noxious stimulus. The first one is Hawa, clean and fresh air. So, what are the Unani principles and Unani advices which are linked to this factor to prevent one from infectious diseases and especially this pandemic? So first thing we got from the literature and has beneficial effect, that is ambient air must be fumigated with air purifying drugs which are having fragrances like Luban, camphor and sundarush. This procedure and this fumigation has antimicrobial efficacy. The second thing is sprinkling vinegar, sirke ka chirkaw in home is very effective. It has certain inhibitory effect on growth of spoilage microbes according to studies. Similarly, smelling spices, which is called as shamum, certain spices such as clove, cardamom, and natural fragrances like love, these substances are having antibacterial, antiviral, anti-inflammatory, mucolytic, and bronchodilator effects. When we smell these substances, the essential oils from these substances directly reach to the bronchial tree, and these substances are having these effects. So these are effective for prevention from harmful effects of the microorganisms. The second thing is makulu mushroom, water and edibles. So the Unani principles and Unani guidelines are detailed here. The first and most important thing is Maushair, which is called as barley. So barley water is good diet, good regime, good recipe in days of epidemics and pandemics. The procedure is mentioned here. Take 10 gram of barley and add 10 to 100 to 200 ml of water. Boil on low flame for 20 minutes and consume it. And according to Unani literature and Unani physicians, it is beneficial in all types of fever. The second thing, as we know about the vitamin C consumption and vitamin C advices from the medical fraternity, according to Unani principles, use of vinegar and sour foods is advisable in days of pandemics and epidemics like lemon achar and all types of tursh khatti cheezein. According to studies, hesperidin and vitamin C are major components of citrus fruits and which appears to counteract the cell infection by SARS-CoV-2. According to studies, they have put forward these hypotheses, and according to them, these appears to modulate the systemic immunopathological process. This research article can be traced here, device given, and Unani physicians have advised use of water or water boiled with spices like ginger, garlic, cinnamon, black pepper. 100 to 200 ml maximum can be taken, not in excessive manner. Then cow ghee is very effective to prevent from infection, and it may be used orally and applied locally on the body externally. One important advice is diet should be minimized to slightly lesser than usual habit. Certain things we have in our kitchen in home which are having good effects such as honey, kalonji, hing. These are having antiviral, anti-inflammatory, immunomodulator effects. Kalonji is having even anticoagulant effect, and these may be helpful in thromboembolic phenomena. And hing is also having a very good effect in gastrointestinal and respiratory and even certain neurological problems. Kalonji is best antiviral. The research shows that it has antiviral efficacy according to SARS coronavirus 1 also. So these can be repurposed in today's pandemic. Tiryake arba and Tiryake ovaira is studied, and according to study may be used every third day to build immunity against infection, and certain things should be avoided like tobacco, alcohol and cold drinks in excessive manner. According to Unani principles, the third thing is physical activities and physical rest has a good effect. Do some mild to moderate exercise daily, especially morning walk, and these are having positive effect on the risk factors such as weight, blood pressure, diabetes. These all comorbidities are having extra risk for COVID-19 patients. So exercise has positive effects on all these risk factors. It not only boosts the physiological functions also, but also the immune function of the body. Excessive physical activities should be avoided, and optimum rest to the body should be given. The fourth, the important thing is good emotions. Harkato Sukun Nafsani. We should stay calm, hopeful, positive, constructive thoughts, and make ourselves happy. Avoid excessive thoughts. Don't be panic and depressed and afraid. Psychiatric health is very much interlinked with the immune system, and new terminology of psychiatry and immune system, psychoimmunology, is introduced in recent years. Sleep should be normal, average is 6 to 8 hours, preferably at night, not in the day. It helps in strengthening our immunity, and we should avoid too less or too more sleep. The last but very important thing is to avoid and to remove all the morbid materials from the body or all the toxins from the body. In other words, we should detoxify our body, and certain methods are adapted for this. So all the morbid matters should be removed from the body regularly, and if we are having any trouble in this removal, we should seek medical advice and medical aid. Proper expulsive measures may be adopted according to need. Similarly, essential fluids like blood and other important fluids should be retained in our body, and we should not do any procedures which may lead us to remove the essential fluids like uh, blood donation in excessive way, or anything use of anything which may harm our essential fluids. So according to यूनानी physicians, फासिद मवाद से पुर अबदान अमराज के लिए मुस्तैद होते हैं. Those body which are having these waste are more prone to infections, and those are who are detoxifying regularly are more immune, and they help their body to remain protected from the infections. So these are all important points for today's presentation. Thanks you all.